Julie. Julianne.
Hi, everyone.
On mute. There you go. All right.
How's it going?
I'm good.
We're getting there. How are you doing, Julie?
Oh, it's been a long day, but I'm all right.
You home now?
No, actually, I just finished a meeting, but they said I could stay here.
Okay, good. All right, Julian, you're all right?
Yeah, everything's going well. Thank you.
Good. I guess the next person we're just waiting for is Beverly. So she should be wrapped. She had another meeting, but she should be wrapping here shortly. And Scott, hello. I don't hear you.
Can you hear me now?
There you go. You got it.
Very good. Thank you.
No problem. You know, I think this should be a discussion on climate change. It's been so damn hot, hasn't it?
Yes, sir.
Man, I swear, what, 100 and something every day?
Yep. Almost like something's out there happening.
Yeah.
I told you my son is very involved with the Sunrise Movement. He actually is part of the Sunrise Movement.
No, you didn't tell me that. I mean, we talked about the Sunrise Movement, but
Yeah.
I didn't know your son was involved.
Yeah, yeah. So it's quite a...
Where?
Well, he started, Seth is a community organizer, and his work has been with Momentum. They train movements. And in the process of that, he got super close to the Sunrise Movement people. The woman who started it, I can't remember her name. But anyway, they eventually hired him.
Where's he located?
Yeah, they hired him, and they hired him to start an Iowa hub during the campaign. So he did that, and then they moved him up. So he's gone. I'm not sure exactly what his position is, the name of it, but he's kind of more on a national base. So he works out of his home now in Boston.
Oh, there you go.
You know, it's been very challenging with the pandemic.
Isn't it? Everybody's working out of their house, aren't they?
Well, you know, they had they were getting a lot of momentum up, but then with the pandemic, you know, you can't really have these mass gatherings. You know, they've had to figure out different ways of dealing, but they're basically the Green New Deal people. So they've made a lot of progress.
And here, Julie, cheers.
Cheers. It's the end of the day.
This is all remote cheers.
Mm-hmm.
There you go, Scott. Everybody, it's a remote cheers.
I'm drinking as much as I can.
Let's see, where is Beverly? And Julian, your day's been all right, you said?
Yeah, everything's going well.
Yeah, our stress level has gone down over here. I hate to say it, but because we had a patient die last week. So
I'm sorry about that.
for that 2 or 3 weeks before, well, you know, Julie, 2 or 3 weeks before they die, especially when you get closer, the restlessness and all that, you know?
Yeah.
We're up 24 hours a day, so.
Yeah, that's a lot. That's a lot. You've been doing that a long time.
We're in our 11th year now.
That's amazing.
Yeah, we've had 78 people die here in our house now.
Oh my goodness, wow. That's a lot.
We got some good ghosts running around though. You know?
Good mojo, because you took good care of them.
I guess. I don't know.
So do you keep people in your house who are
Yeah.
ill?
Yeah, we're a hospice, and we work with almost entirely with Christus Healthcare Hospice, where Julie is one of the chaplains there. Yeah,
Oh.
so they just send us patients, and we take care of them until they pass, and someone else comes in, and yeah, it's our home. So
Yeah.
yeah,
That's a
no
great
more
thing.
than 3 people at a time, you know. So that's about all we can handle.
Mhm.
That's a lot. That's a
So.
lot.
Yeah, the last guy who was here, he was, that goes back into Medicare for all stuff. He came here in January of this year, and so he was here like 7 months. But immediately after he got here, he had long-term health insurance with John Hancock, and so they're supposed to reimburse him for any expenses related to the care he's receiving with us. As of last week, they still hadn't paid. Oh, we transferred to another apartment. It's been lost. 2 weeks later, it's been lost. Yeah, talk to the social worker. Talk to Andrea. She'll tell you. She's been working on it for months, trying to get them to approve it. So our guess was they were just waiting him out to see if he would pass because they knew he was in hospice. Before they would do anything with the claim. And I doubt his estate's going to go after the money.
Hmm.
Oh my gosh.
So what
No,
about,
it's terrible. This is the second one we've had with John Hancock, and the same thing happened with the other guy. But in that case, his wife survived him, and she actually sued Hancock. Now, whether or not they were settled up, but
Oh,
I think
don't
that's all
even
they do.
tell
They
me
just
that.
wait until you pass, and then well, try to sue us. We'll drag you out until you pass.
so what kind of dollar figure are you talking about?
Oh, and this past guy was $3,000 a month, so he was 7 months. Over $20,000. So,
Mhm.
not to mention all of his medication, because hospice pays a certain amount of medication, whatever Medicare will allow. But he had all this other medication. Oh no, it was amazing. I was talking to him many times. His medication would come in the mail, and so we had to open up the packages for it, right? And the invoices were there. Some of his medications were costing $300 to $400 from him.
Wow.
What the hell? They were just chewing him up with medication costs.
Mm.
But that's one reason why we need Medicare for all.
Absolutely.
Wow. That's scary. Very scary.
Okay. Let's see. There's some more people here want to come on. Admit. Okay. I met them all.
So what do you think about the vice presidential pick? Are you allowed to talk about that?
Yeah, we can talk about anything we want to. Let's see. She says she's waiting. I don't see you. Oh. Oh, there's Beverly. Okay. All right. Done. All right. Now we got to find Beverly wherever she's at. I see her there. And then Julie, you're also a co-host. So I got you and Beverly as co-hosts here. Okay. Now, where is Julie? I know Julie, Beverly. There's Beverly. All right. Beverly. Can you hear me? Red, do you see Beverly there?
I don't see her.
I see her.
There's Beverly. Yep. You got it down, Beverly? You got to turn your audio on, Beverly.
Just look in the bottom left.
Beverly, can you hear us yet? Well, she's gone. Maybe she needs to re-sign back in. There's that. Hey, technology is great when it works. Or, well, I should say, when you know how to work the technology. All right, Beverly.
I'm there now. It worked
Now
this
you're
time.
there.
Third time's a charm.
Jeez, I don't recognize you with your hair down.
I know, and a t-shirt.
And a t-shirt. All right. We're
Oops,
ready
tonight.
to go. Julianne will be kind of the moderator here, and it'll be yourself, Beverly, and Julie. So, all
All
right.
right, well, I'll go ahead and introduce myself. My name is Julian Villarreal. I'm actually not a medical doctor. My PhD is in material science and engineering from the University of Texas at Austin. But I've been in the fight for healthcare justice for the past several years here in San Antonio as part of the Bexar County Green Party. And we also organize with several other groups here locally, including a group that puts on a yearly march called the Medicare for All March. And so yeah, we've been in the fight for a while. And I'll go ahead and just open it to everyone else who wants to introduce themselves, but primarily our panelists.
Beverly, you want to introduce yourself to everybody?
Okay, my name is Beverly Tumala. I'm a nurse. I've been nursing for well over 30 years. I've been in numerous settings. I've been in the military. So I worked in that medical system. I've also, probably the majority of my time spent here at University Hospital, caring for many times the indigent and those without health care. And I've seen what that does and how the underserved, it really suffers from lack of health care. So I was there for about 24 years, and now I do hospice work, hospice here in San Antonio, and I've been doing this for about 4 years. Okay. Julie, you're next to me.
I'm Julie Woody, and I am a hospice chaplain. I work with Bev. I was an attorney for 20 years. I was a litigator, and then I was an appellate attorney for many years in Texas. I'm from up north, but I went to seminary in 2007, so kind of made a major shift in my life. But I went to seminary, and since 2010, I've been a hospice chaplain. So I've kind of seen the situation from that perspective. I also, just 1 week ago, found out that my husband has ALS. And so we are very much looking at sort of insurance issues. I was on the phone this morning dealing with that. So actually we're feeling very, very thankful that Robert has Medicare. So Medicare for all. We're also struggling with the fact that my health insurance is tied to my employment. So I'm only 62. So that's an issue. So we're kind of bumping up against these issues. So they're very close to me right now. Also just dealing with my patients and their families. I spent 20 minutes, half an hour this week talking to someone who's very upset that her long-term healthcare insurance is not working the way that she thought it would. After
surprise on that.
Yeah, after paying into it for a very long time, which makes me nervous because we have it and we need it, and we'll see what happens to us. So we're all sort of at the, at the mercy of our insurance companies.
And Beverly,
Sad
before
story.
you joined us, I kind of mentioned, without mentioning names, that we had a patient recently pass that had been trying to get his long-term health insurance through John Hancock, and he passed away, and it's still not resolved.
Yep.
So
Yeah.
They sure collected a lot of money from him, didn't they?
oh yeah, overall, I don't know how many years he paid. He probably paid 20 years worth into the premiums. So
Well, yeah.
Well, Tom, since you're kind of hosting this whole meeting, do you want to kind of just like frame the discussion for us briefly?
well, I was kind of making a joke earlier that there should be a discussion of climate change. It's so damn hot. But in reality, I think that brings us back to Medicare for all, because I hate to say this, but we got 2 polar ice caps that are melting. The snow's melting in the Andes and the Himalayas, and somewhere there's going to be 100,000-year-old carcass is going to thaw out, and it's going to release all sorts of pathogens, and we're going to be right back where we are today with another viral outbreak. People are going to be without jobs. Like Julie was saying, their health insurance is tied to their job. So no job, no health insurance. The next pandemic is going to be worse, So I think it's all tied together. And I just don't understand why people just won't get behind Medicare for all. I mean, they talk about trying to tinker with the ACA. Well, I don't think the ACA is going to be able to do anything with like long-term health insurance with John Hancock that doesn't want to pay it. I mean, I could be wrong, but I don't think so.
Yeah, so since we kind of have a couple folks here with experience in hospice care and end-of-life care, I'm kind of interested to know from that perspective, because as many people are aware, most folks spend the most amount of money on healthcare when they're dying, right? So, that's one of the discussions that I know happened during the debate over the Affordable Care Act. And, unfortunately, end-of-life planning got framed as death panels when we know that everyone's going to die and we should be prepared for it, right? So if Beverly, maybe you want to start off?
Yeah. I was at the Robert B. Greene working in a clinic. Let me frame this clinic. It was very interesting. University Health System, they bring on a lot of the indigent population that are here. and they have sort of a health plan through them called CareLink. And CareLink, if you use it, you've got to stay within the health system to use it. And it's pretty basic, but it does preventative stuff. It'll treat, you know, what you've got. But so the ACA happens, you know, Obamacare, whatever you want to call it. And people came to me and said, can you believe that, you know, we're going to have these death panels and they're going to decide who can live and who's going to die and who's going to get the benefit and who's not. And I tried to explain to my patients that that was not the deal. What the deal is, what that was supposed to do was for us to bring up like a plan for dying. When we've got these people who've got cancers and coronary artery disease and heart failure and end-stage lung disease, kidney disease, you know, we need to have that discussion. Make them a do not resuscitate. Talk about hospice. Talk about palliative care. Doctors don't get paid for that visit. And so you've got 15 minutes to go through meds and their chief complaint. They don't have time to talk about a death plan. You know, what do you want to do at the end of your life? How far are we going to go with this? Or even have time to talk about there's nothing more we can do. And we need to have a do not resuscitate. We need to have something in place so that you don't end up back here on a ventilator, getting CPR, and spending thousands of dollars a day at the end of your life when it's futile. Our clinic had the luxury of, I'm an RN, I'm not a nurse practitioner, I'm not, you know, any sort of practitioner, I'm an RN, but I had expertise in heart failure. And these patients kept coming back to the hospital. They just kept coming back. And so these heart failure patients would go home a week later. They didn't get taught about their diet. They couldn't go get their meds. They didn't have any money, or they couldn't get in to see the doctor to get the prescription to go get their meds. So they would just end up back in the ER. And each visit cost us anywhere between $3,000 and probably $12,000. So they sent me down to the Brady Green and just sent me all of these people. And they were able to just walk in. There was no charge for their visits. We were able to get through the health system a 30-day supply of medicines when they left the hospital, so they could come to me and get established and get medicines through the pharmacy. And we dropped those hospitalization rates very quickly. But we had the luxury to sit with these end-stage heart failure people and talk to them about a do not resuscitate. You know, what do you want this to look like? Who can take care of you? And talk to them about hospice and other things out there, because people don't know about end of life care and who's going to pay for it. And unfortunately, CareLink does not pay for hospice care. So we would have to go out hunting hospices and asking them to take our patients pro bono.
Because they're indigent and don't have health insurance.
Exactly. And they're not going to get it because they're sick.
Hey, yeah, right. Pre-existing condition.
There you
They're
go.
dying.
Yeah. And what was real frustrating for me, so I was a heart failure clinic I ran, and I was attached to the transplant clinic. And a lot of my patients were young. They were in their 30s and their 40s and their 50s who got sick and couldn't work anymore. So a big part of my job was to get them on Medicaid. So we went through that whole ordeal. Well, and then we'd also apply for disability. So as we're waiting for Medicaid to see if that was going to happen, we've applied for Social Security, and most of the time they didn't get picked up the first time. So we'd reapply and they'd get picked up maybe the second or third time. Well, now they're on for disability income, but we don't have any medical care for them. So once they got their SSI and they got their disability check, we had to wait 2 years to get Medicare. Now, a lot can happen to these people in 2 years. And I always thought that somebody back in that made the decisions either figured out they'd either die get better, or just give up and go back to work. I can't tell you the number of patients I lost in their 30s and their 40s who didn't have the chance to get a defibrillator, who didn't get the chance to get a heart transplant, who didn't get a chance to get any bridge to see if they could qualify for any of these things, because we had no money to pay for it. So they were the ones that ended up dying in the ICU, attached to drips and ventilators and, you know, machines to make them pee. And because we couldn't get the Medicaid. I had this one gentleman in particular, he worked at McDonald's and he had 5 children, and he had a very aggressive form of cardiomyopathy that he inherited from his mother. I took care of his mother as well, and she died. And when we evaluated him for Medicaid, we're like, you've got to get it. There's just no way. You've got all these children. His children got it. He was $13 over income to get Medicaid. And I thought somebody calculated that very well. And he didn't live those 2 years. We buried him. And so, you know, the system is just broken. It's just broken. Okay, I'll stop.
Well, that's unbelievably, you know, frustrating and heartbreaking, you know, and I think that's why we're all here, is because we, you know, we have our own different experiences, you know, from one extreme to the other, of having to deal with and wrangle with all of these myriad issues, you know. Julie or Tom, do y'all want to speak?
Well, I would just add to that. It is heartbreaking, but it's also immoral. You know, I think it's time for people to just stand up and say, this is immoral. It's wrong. That should not happen. The idea that our country spends, what the statistics, 80% of our healthcare dollars go to end of life. For people who are suffering and are on machines, and that is not a quality of life. The fact that we're not educating them and making a system where they do almost, we should be making sure that people who have no chance of survival are put on hospice. I mean, hospice has been proven now to extend your life, literally like the time that you live, that it will extend your life. It extends quality of life. You know, I think we have to get a moral backbone, honestly, in this country, to say it's immoral to be spending that much money at end of life for people. It's immoral not to be educated and make this possible for people. It's immoral not to have Medicare for all, where everyone can get, you know, the healthcare they need. It's just, it's all so, yeah, very hard to hear those stories. It's just like makes your, what is wrong with us? But yeah.
No, and we can testify, as Beverly knows, we've been taking care of patients and we have the same problems over and over. But our patients do live longer, don't they, Beverly?
Oh, they do. They do.
They come on to the care that we give them, and that's part of, we're not eligible for reimbursement. The people that come stay with us, it's private pay. Mm-hmm. They're not eligible for Medicaid or Medicare reimbursement because we're not a facility, so to speak. But you don't want to go to a facility. These people don't want to go to facilities. And I think that's what's so special about what we do, because we're small. We do provide one-on-one care, basically. And I think that's why people, exactly.
It is better, yeah.
Yeah.
It's not a nursing home. And now with all sorts of the COVID deaths inside nursing homes, you would think we'd start reevaluating whether that is the model we want to continue with.
Right.
And again, everything is related. People are losing their jobs. I mean, of course you have to have a certain, I don't know, not everybody is cut out to wipe butts. Which
I know I'm not.
But I mean, with so many people that are in nursing homes, if we can get them out of nursing homes and put them into a a private care home, I think they would be better off. Everybody would be better off. And the person who just lost their job would be better off because they have somebody there in their house taking care of them.
Yeah. Medicaid should cover wherever you are. I agree.
So just like hospice will take care of you wherever you are.
Right. Medicaid should cover wherever you are. It's cheaper.
Mhm.
It's our tax dollars.
Oh, it's a lot cheaper. I can tell you it is. It is.
No, I know it is. Yeah. It's craziness.
And I think one of the things that we've seen too is that a lot of the people that come stay with us are supposed to be here, 3 months, 4 months, 6 months, but they're out of here sometimes over a year, 2 years because of the level of care they're getting. And I just know that if they were in a nursing home, that would not happen.
Oh, no. I tell my patients often, whether they're at home or they're in a personal care home, when we sit at hospice, every 2 weeks we sit and we evaluate patients and their eligibility for hospice. That happens about every 2 to 3 months, depending on what cycle they're in. And, some of these people last a very long time. And, and I always say, if this person was in a nursing home, they would have been gone by now. But because they're at a place like, the Wakely's personal care home or someone else's, they're getting the attention they need, they make sure they're fed, they're clean, they're gotten up and sat in a chair, so there's some mobility happening. We're not getting the skin breakdown and those pressure sores that we see in the nursing homes. Nursing homes, I hate to say it, but there's a lot of neglect there.
Yes.
Yeah, so kind of what I'm hearing is that there are two major issues just within our current system, and that's quality of care and cost. And I guess a related would be access to care, especially like Beverly was saying, the indigent and whatnot. My question, and anyone who's listening, you're free to put your questions in the chat as well. When we talk about Medicare for all or universal health care, single payer, what is it that we mean? And we obviously use our current very unjust system as a kind of reference point, but if those of you who have experience in healthcare, if you could get your wish list and create or envision a new system, what would it be?
Medicare for all.
I think, a lot of people are overwhelmed right now with the way, how do you have to apply for disability, let's say. You're young, at 65, I think things happen automatic. I haven't reached there yet, but, I'm assuming it's pretty automatic. You get Medicare. But when you're having to apply for it on your own, it's very overwhelming. And, many times you have to get a lawyer to get you into the system. A lot of my patients had to get a lawyer, a disability lawyer, to prove their case and get them on. And I always, I got very cynical and thought, there's got to be some sort of a setup here, because the lawyers are getting paid. Once these folks got their Medicaid or their Medicare, they're going to get a big chunk of that. They have to be paid. And so I would like an easier system, an automated system where, I don't know, when you're born, you're just in a medical system and that stays with you. Your parents are in it, and there is, one payer. You can get your meds anywhere. It would take care of things like getting folks to the doctor. If you don't have transportation, you should have a way to get to the doctor. And then just more emphasis on home health. Hospitals are places where people get sicker and sicker. And home health, if a nurse comes into the home, like hospice, we can provide a lot of, hands-on, eyes-on, and call the doctor and get what we need. And people don't need to, drive to the hospital or stay in the hospital for weeks and weeks.
No,
There's
I agree with you
a-
100% that home health is a bit, that's the way it should be. And you're
Mhm.
asking about what I like to envision. I would like to see the Medicare for all. That would be part of that whole process. You need to take care of yourself first. And I think all of us that work in hospice, people are saying, I wish I had taken better care of myself, but they didn't. But if they had that nurse that could come by every week, I mean, back in the 30s and 40s, didn't they have nurses used to make regular rounds? This would be their neighborhood.
Doctors. Yeah.
And the doctors too, but this would be their neighborhood. So they would walk the streets, and they'd have, I don't know, 500 people they would see on a regular basis. I mean, I think if we can have that home health piece as part of Medicare for all, it would go a long way to making sure people stay out of hospice a lot longer than they need to be.
Mm-hmm. Like thinking of you, Julie, when your husband gets sicker and sicker with this disease, to have a nurse come by your home once a week or twice a week just to check on you guys and educate you, and having to put him in a car and take him to the doctor.
Right.
Or in an ER.
And, we will have some or all of that, but because he's over 65, thank goodness, because he has secondary and insurance through his pension plan, which most people don't have. I think that the moral fortitude of this is everyone should have access to that kind of health. It shouldn't be based on where you're born or who you're born to or what job you have or what luck you had or not. Everyone in this country should have access to the same basic health care. And, our healthcare system, first of all, is so broken, as we know, but also, we pour more money. Our healthcare system is so heavy on the money. Where does that money come from? All of us.
Yeah.
Where does it go? Into profits for these the fact that we have this for-profit medical system for the whole country it's insanity.
And I think
people understand when they say, oh, I don't want to lose I love my health care insurance. No, you don't. I think people don't really understand what's going on here. They don't get it when we say all this money. They don't understand that's your money. Your money's pouring into a healthcare system that's not taking care of you like it should, because most of that money is going to shareholders. Really. Literally.
Even more ridiculous is, these copays. My nephew, perfect example. They have some health insurance through his work, but, and they pay a huge amount, $300-400 a month, but they don't go to the doctor because they've got a deductible. And so, they don't have they've paid their insurance, but they don't have the money to pay for the visit because they have to meet that deductible.
Right.
Yeah, my daughter, Kelly, and her family, 2 kids, they were in ACA. They could make those monthly payments, but she said, I finally gave up. There's no way I would ever be able to make the deductibles. She says, it's easier for me just to go out and pay for the medication, pay for a doctor's visit, because I'll never reach those deductibles. And then you got the copays on top of the deductibles.
Right. But the problem with that is where people find themselves. But if they don't keep that insurance and something huge happens, honestly, I think a lot of people have insurance just to have that major medical piece, and then they don't use it for the everyday. It's just so wrong. The number one cause of bankruptcy in this country is medical problems, medical payments. That is absurd. That's absurd. There's a lot of things absurd about us right now. But yeah, this is one of them. It is absurd. It's wrong.
And what I'm saying, I think, at least from a political standpoint, that there's so many existing politicians and candidates that just don't support, that just don't see what you're talking about as a moral issue.
I know, they don't.
Money involved when their campaign contributions are coming, like Julie said, from the lawyers.
Right.
Oh, well, they're just they're not an insurance company lawyer. No, but they're probably doing, like you said, disability claims, and they get paid for that. You know,
Right.
it's just so much money is coming in from the insurance company lobbyists to candidates and to politicians. I don't know how we're going to break that.
I don't either. I don't either.
Well, I'll share a short little personal anecdote from my side. After college, after graduating from college, I had the opportunity to do a couple of so-called study abroad, but it was really internships abroad, and I spent one summer in Germany through the German Foreign Student Exchange Program called the DAAD, and it's set up by the German government, and it's meant to facilitate these exchanges. But part of the exchange program was that I got health coverage during my internship. And in fact, because I was already being supported by a university through a scholarship in Germany, I didn't have to pay anything out of pocket. All I had to do is literally sign a paper enrolling for the exchange, the student exchange, and I was covered, and it would have covered me for an entire year if necessary. And then the subsequent year, I did another internship, and I was working at a company in Italy, and there all they asked me to do was pay €50 to enroll, and it covered me 100%, and it would have covered me for an entire year as well. Super easy,
Wow.
seamless, and luckily I never had to go to the hospital or seek any type of care. But even when it came to going to the pharmacy and getting some generic drug, also very, very easy, as long as you're enrolled. And again, that's like 99.9% of all people in these countries. All of that medication is under price control. You're not going to be gouged for anything. Like almost all of your medication is within reach for most people. And if it's not, well, then there are other ways to pay for it too.
In 2016, I remember I was at a forum on healthcare put on by Representative Lloyd Doggett and a state senator. And so they gave their little presentation up on the stage. Then they asked if anybody had any anecdotes or any stories they'd like to tell. And I remember this one young guy, everybody's young to me now, but this young guy, probably late 20s, early 30s, he came up and told how his dad had just died of hepatitis C because he didn't have his health insurance company would not cover it. The medication, I think it was like $100,000, $95,000 for the Hep C medication 4 years ago. And his dad died. So I got up shortly after that to say, I too had hepatitis C, but because I'm in a socialized medicine program called the Veterans Administration, that $100,000 medication that his dad couldn't afford or his insurance company wouldn't pay, I was able to afford it, and it cost me $27. That was it. The most I ever pay for my medication at the VA is $8. Regardless of its cost, I pay $8. And it was sad to see and hear these two politicians had absolutely no comment as I'm talking about why we need Medicare for all. Here's a guy whose dad just died. Here I'm saved because I'm already in a Medicare for all system, the VA. And despite all of its problems, it's still good for me. So I think there's so many anecdotes we can talk about all the time, and people just aren't listening. I mean, the younger folks are listening. I think Julian and many other younger folks are listening, and they're pushing for it. But there's so many people that are just so entrenched, they're just not listening. And I don't know how or what I can say to make them start listening.
Well, I think,
Until they're faced with it.
yeah.
I really, in 2016, again, when I was running for Congress back then, I ran into a Republican up in New Braunfels, and we're at a big luncheon or something for a Chamber of Commerce, whatever. He sat next to me. His wife was in hospice. And so as we started talking, I think it dawned on him what I was trying to talk about to everybody else. So I think until it hits them in the face, I don't want a socialized medicine program. And that's how they see Medicare for All, as socialized medicine. Yeah, but so many stuff already is socialized. All of our public schools are socialized schools. I mean, come on. All of the fire departments, they're all socialized. We pay for it from our taxes. So, I mean, this is just another logical step, Medicare for all. But,
Well, I think people are fearful that they're going to ration medicine. So let's say I'm 89, 90 years old and I'm on dialysis. Well, they're going to decide that I'm too old for it. And they're going to take me away. They're going to just shut it off. I need a bypass operation. Well, I'm going to have to wait because, there's not going to be an opening and I may die before they can take me. I think these are fears. I don't think they're founded. Canada has this system, and I have Canadian friends and relatives that, they might have to wait a little bit, but, it's not months and months.
I think it's fear, because we're talking about my life and my health. So it's a fear that I won't get the health care I need if I go into a socialized medicine program, despite the healthcare professionals telling us, Beverly, despite Dr. Smith telling us Medicare for all, they just still don't believe it.
But what about, I think in any program, and if socialized medicine or Medicare for all comes to be, I think that we need to teach our public that we need to be good stewards of that money as well. And what sense does it make to have a person who's 90 some years old on dialysis 3 days a week? There's been a disconnect with that physician to teach that patient that, there's, we can prolong your life, or we can prolong your suffering, right? And, does everybody need to be resuscitated? Does everybody need, at 90, 95, do they need to have a bypass operation? Can we just send them home and make them comfortable? Because if they have that operation, chances are they're going to be in the hospital for months and months and months, and probably not
a quality of life at all.
So there are things we don't need to do because we can. We need to be good stewards and look at what we're doing. But doctors they're afraid of being sued. They're afraid of, they just have this mentality. I can do it because I can. There are these defibrillators that go into cardiac heart failure patients that have arrhythmias. These defibrillators cost anywhere between $30,000 and $40,000. And in our clinic, we were very selective about who got them. So my patients that had end-stage disease, I'm talking, we call it class 4, they're symptomatic at rest. They can't walk, 20 feet without getting short of breath. It's a struggle every day just to get through it. And they can't wait to die. They just want to be comfortable. So when an event happens at home, EMS shows up and takes them to the nearest ER. They don't bring them to where they're being seen and where their doctors are. They take them to Downtown Baptist. Well, Joe Schmo cardiologist, electrophysiologist, pacemaker guy comes in. He sees a procedure that he's going to get reimbursed for a lot of money. And he goes in and tells his family he needs this. So they put it in.
And they're 93 years old, right? Exactly.
Yes, and they're dying. They're dying. We get them back. And, we sit and have that long conversation, and you know what we've done? We shut it off. So they've got a $30,000-$40,000 device implanted in them that we shut off because they don't need it. Our money paid for that.
Yeah, you know, the for-profit healthcare system, you know, it's like the profit motive is what you see as, you know, causative for a lot of the injustices, you know, like what you mentioned, right? It's like doctors in the hospitals get paid per procedure, per, you know, medical equipment, right? You know, if we had a legal system that worked like that, you know, you'd have the longest legal opinions in history, because, you know, we don't pay lawyers per word, right? We pay them, you know, to defend and whatever, you know. But we pay doctors and hospitals per procedure, and it just leads to more waste, you know. So we have a question from one of our listeners. Courtney says, what is your response to people about paying for something like Medicare for All? That's the response I get from a lot of people, is how are we going to pay for it?
Well, why can't I, you know, through my employer and wherever I am, if I'm going to pay $200 a month, you know, that I pay for $200 a month, but it should be Medicare for All. I can take it with me. Those are my healthcare dollars. I should be able to decide how I use them. And let me think about that for a moment.
Well, let me see if I can hand it out to Laura Palmer, who's also waiting in the wings. Can you unmute, Laura?
Hi.
There we go.
Hi, everybody.
Hi.
Thanks for letting me join you this evening. I just wanted to comment on Courtney's question. You know, we hear that all the time. How will you pay for it? And I really appreciate the expertise and you guys really being in the trenches with this issue. But just from my sort of perspective, I feel like socially we make so many decisions based on this idea of speculation and whether or not it can be made to be profitable. Obviously, you guys are speaking to that. There's all this fear mongering about socialism, but when you get right down to it, we need to be making these decisions based on people's actual needs and the needs of our society. And this notion that inserting a giant for-profit industry between people and their healthcare is somehow, you know, could ever be less expensive than just doing what needs to be done and providing people with the services that they need. This is across the board in terms of public services, you know, healthcare certainly, but prisons, why do we have private prisons? There are so many things that are really social responsibilities that the government is, you know, privatizing and abdicating this responsibility. And so as a Green, I feel like, you know, we're really asking for a shift of prioritization. You know, we can do the things that we need to do. We create tremendous waste by driving things because of capitalist speculation. Socialism's much maligned, but as Tom points out, these are the seeds of public schools, fire departments, roads. And so we need to get back to some sort of reasonable accommodation between making decisions for the public good and being just, pardon this expression, just constantly raped by business. And so I challenge people who say how we're going to pay for it. How do we pay for wars? How do we pay for corporate bailouts? You know, that question is always disingenuous because what's important gets prioritized. And what doesn't get prioritized gets sent away to perish on its own. And so I just hope that we call for a philosophical shift when we hear that question. Thank you for letting me jump in.
I totally agree with you. Totally.
Thank you, Laura, for your comments.
The idea of asking, how are we going to pay for this? The answer is, we are already somehow, all of us together as a country, paying for this bazillions of dollars to go to these companies. These insurance companies and big pharma are making tons of money. Where does it come from? It comes from us. We are doing that. So how are we going to pay for Medicare for all? We're going to pay for it. Instead of giving all the money to them, we're going to use it together to take care of each other. I think part of the sort of overarching morality issue is, how can we become a country where we want to take care of each other? You know, why is it that I should have better health care for my husband than someone else who doesn't have the same advantages? That shouldn't be that way. Yeah. I mean, that's what Bernie Sanders is saying. Healthcare is a human right. We should all be taking care of it together as one country. I don't know. Do we have the moral leadership to make that happen?
We need to take care of each other.
We need it, but I don't think we have it yet.
We're not doing that, but that's what we need to do.
That is what we need. But this question, I totally agree with her. The question of how are we going to pay for this, that's a false question.
Right.
No, there's no question we have enough money to pay for Medicare for all. We're already...
Yeah. Interesting things in 2016 when I was running for Congress back then, and I was running around talking about Medicare for all. My brother at the time, he kind of followed your path, Julie. He went from the corporate world and became a Catholic deacon, and now he's working for practically nothing at a Catholic church. But before he left the corporate world, and those of you who live in Texas, you know, Time Warner Cable. Well, he was the #2 guy in the state of Texas for Time Warner Cable. So he made a lot of money. And but he was all for Medicare for all. And he told me that he was constantly battling with the higher ups in Time Warner Cable because he was so high up. He didn't have a lot. He had a lot to do, but he still had a lot of time to sit there and come up with new ideas. And he figured out how much money Time Warner Cable could save by letting the country move to a Medicare for all system. He said, we are spending so much money. We have a whole departments within our company just to fill out forms to submit to the insurance companies, who then turn around and send us more forms. Then we fill them out and send them out to the patient, who sends it back. He was all for Medicare for all, and I'm sure he is now too as a Catholic deacon. But I think that, like you said, we have to start shifting priorities, and let's start really thinking about how do we do that. And I think the first step is we have to convince the politicians. They have to do it. I mean, you can want it, you can want it, you can want it, we can all want it. But until those 435 men and women up in Washington in Congress and those 100 senators decide they're going to do it, it's not going to happen. And as long as we continue to elect people to that representative or the Senate or even a president that doesn't support it, Julie and I talked about this before. Centrist gradualism is literally killing us all.
It is. It is.
We have to stop that. We have to, and again, people need to understand we have to act now on everything. I mean, those days are over with. And I think this pandemic has brought it to a head. Those days are over. We cannot wait anymore. We have to get something Medicare for all now, because I can guarantee you that there's going to be another pandemic. If it's not next year, it's going to be the year after that.
Right, right.
It's going to happen. And it's either going to be accidental or on purpose, but another one's going to be right down the road. It's what's happening. So.
Well, we're coming up on 8:30. If there are any final comments from any of the panelists or any burning questions, feel free.
I just want to thank everybody for joining us tonight. Beverly, Julie, and I guess Beverly, we'll see you tomorrow.
See you tomorrow.
And we'll see you, Julie, whenever we see you again.
All right. Keep the faith.
Everybody, thank you so much. We appreciate everything.
Thanks, Julian. Yeah, wash your hands.
Yeah, exactly. Take care, everybody.
Bye.
Bye.